Hello, welcome to this webinar titled Diabetes and Eye Disease. My name is Caroline Coroner. I'm a registered nurse and a credentialed diabetes educator. The human eye is an extraordinary sensory organ, and our vision is one of the most precious gifts that we have. Your eyes are at work from the moment you wake up to the moment you close them to go to sleep. They take in tons of information about the world around you, shapes, colors, movements, and more. Our vision allows us to be aware of our surroundings, and 80% of everything we learn is through our sight. Vision is part of who we are, and importance for our eyes is often underappreciated until we experience a problem with them. As we get older, changes to our eyes mean our sight becomes more vulnerable. For people living with diabetes, vision loss is one of the most major complications, so it is important to stay on top of eye health. With diabetes, you have an increased risk of developing eye problems, which, if left untreated, can lead to reduced vision or even blindness. You can greatly reduce your risk of serious vision loss from diabetes through regular eye examinations and timely treatment. The sooner eye problems are detected and treated, the better the result. In this webinar, we will explore how eyes work, what types of problems we can get, what their causes are, and how you know if you have eye problems. We will talk about diabetic retinopathy in more detail, and we will look at the different stages of diabetic retinopathy and what happens at each stage. And we will look at the risk factors for developing eye problems, particularly for people with diabetes. And most importantly, we will talk about things you can do to maintain good eye health and hopefully prevent problems. You can check out some of the parts of your eyes just by looking at the eye. Firstly, you see two eyelids, which are responsible for protecting the eye. The eyelids help keep the eyes clean and moist by opening and shutting several times a minute. This is, of course, called blinking, and it's both a voluntary and involuntary action, meaning you can blink whenever you want to, but it also happens without you even thinking about it. The eyelid also has great reflexes that protect the eye. For example, when you step into bright light, the eyelids squeeze together tightly to protect your eyes until they can adjust to the light. The iris is the colorful part of the eye. When we say a person has blue eyes, we really mean the person has blue irises. The iris has muscles attached to it that change its shape. This allows the iris to control how much light goes through to the pupil. The pupil is the black circle in the center of the iris, which is really an opening in the iris. Pupils will get smaller when light shines near them, and they'll open wider when the light is gone. The white part of the eyeball is called the sclera. The sclera is the protective outer layer of the eye and is made of a tough material, namely collagen and some elastic fiber. The sclera has the important job of covering most of the eyeball. The cornea, a transparent dome, sits in front of the colored part of the eye. The cornea helps the eye focus as light makes its way through. This too is a very important part of the eye, as the cornea gives your eye a clear window to view the world through. As mentioned, the front of the eye is made of the cornea, the iris with the pupil, and the lens, and these parts help focus an image onto the retina. The retina is the light-sensitive membrane that covers the back of the eye. This membrane consists of millions of nerve cells which gather together behind the eye to form a large nerve called the optic nerve. Some retinal nerve cells are only sensitive to color perception, whilst others are specifically sensitive to movement. Movement-sensitive cells enable us to view things at the edge of our vision, known as peripheral vision. This helps with activities such as driving. The macula is responsible for central detailed vision, allowing you to see fine detail and color, read and recognize faces. Vision develops through the first few years of life, and by the age of 8 or 9, vision is fully developed. Many common eye conditions of childhood, such as a turned eye, the squint, a lazy eye, amblyopia, and uncorrected refractive error, the need for glasses, can be corrected if detected early. The eye can quickly change focus to automatically clear an image when an object is looked at across varying distances. As we get older, usually from the age of 45, the focusing lens inside the eye becomes less flexible. This happens gradually, and the result is loss of the ability to easily view objects at different distances. Glasses for reading overcomes this problem, and that's why the majority of older people, I guess myself included, need to use glasses for near vision. This is a normal part of aging. Most humans have two eyes that, when working together, normally have overlapping vision, which combine to produce a single image. When an object of interest is seen, the eye moves to point directly at the object. The light reflected from the object enters the eyes and is focused through the optical components within the eye towards the back. The light is focused to a pinpoint on the back of the eye in an area called the macula, on a light-sensitive membrane that covers the back of the eye, which is called the retina. So, in a way, your eye works similar to the way a camera works. When light stimulates the nerve cells in the retina, messages are sent along the optic nerve to the brain. Optic nerves from the two eyes join inside the brain. The brain uses the information from each optic nerve to combine the vision from the two eyes, allowing you to see one image. The overlapping gives us depth of perception, and this allows us to judge distances and see the world around us in 3D. Now that we understand a bit more about the workings of the eye, we can understand that diabetes can cause both short and long-term eye problems. Blurred vision and infections are the most common occurring short-term eye problems. Conjunctivitis is a short-term eye condition that is quite common, particularly in children. It is a condition that causes inflammation and redness of the lining of the whites of the eye and the membrane surrounding the inner eyelids, called the conjunctiva. Conjunctivitis may be due to bacterial, viral, allergic, or chemical causes. Uveitis is inflammation of the middle portions of the eye, the uvea, and can be caused by viral, fungal, bacterial, or parasitic infection. A stye is a painful eye infection that occurs along the lash line. It results when oil glands on the eyelid become blocked. Symptoms of a stye include pain, swelling, and redness. The risk of serious, more permanent eye problems increases when you have high blood glucose levels over a long period of time, or if your blood pressure or cholesterol levels are high. More on this later. Long-term eye problems include diabetic retinopathy, macular edema, glaucoma, and cataracts. We will go through each of these problems in more detail one by one. But to help get a better understanding of how particular eye problems can affect vision, I will use this particular image throughout the presentation to highlight the changes that may occur. So high blood glucose levels can cause a short-term blurring of vision due to temporary changes in the shape of the lens of your eyes, something like this. Blurry vision can occur at different times in the diabetes journey. Before you were diagnosed with diabetes, when starting a new treatment for diabetes, or when blood glucose levels fluctuate. I often think of it as the excess glucose in the blood, making the lens a bit sticky, and hence it cannot adjust itself as easily as it should. Talk to your doctor, your diabetes educator, or your eye health professional if you experience blurred vision at any time. Cataracts can occur when protein from the lens clumps together and makes the lens cloudy. This can reduce vision. Cataracts are very common in people over the age of 80. Although sun damage and aging are the main risk factors, people with diabetes tend to develop cataracts faster and at a younger age than others. The cloudiness of the lens in cataracts can affect vision by reducing sharpness of an image, like this. Without treatment, cataracts will continue to develop until eventually vision loss is complete. When cataracts affect the vision significantly, cataract surgery is often required. In this type of surgery, the ophthalmologist, the eye specialist doctor, will replace your own cloudy lens with an artificial one. This is usually day surgery, which means that you get to go home a couple of hours after the procedure is completed. Glaucoma occurs when there is damage to the optic nerve, causing a buildup of pressure inside the eye. It can affect anyone, but it is more common in people with diabetes. There are two kinds of glaucoma: open angle, caused by conditions that are chronic or long-term, and acute or closed angle glaucoma, sometimes also referred to as angle closure, which is the kind that occurs suddenly. There are no warning signs of glaucoma, as it does not produce symptoms in the early stages. But problems can be detected early with regular eye checks that include measuring eye pressure. Your optometrist can check for glaucoma by using a machine called a tonaref, which blows a gentle puff of air into the surface of each eye. By the time an affected individual notices visual changes, treatment may stop further vision loss, but it cannot reverse existing vision loss. So early detection is important. Glaucoma is usually treated with a prescription of eye drops, though occasionally laser or surgical procedures may be needed. As mentioned, if glaucoma is not treated early enough, it can lead to loss of vision or blindness. Usually, the external vision is affected first, causing a sort of tunnel vision, such as in this image. Diabetic retinopathy occurs when, over time, high blood glucose levels damage the small blood vessels in the retina of the eye, causing them to leak fluid. New blood vessels grow to compensate for the ones that are damaged, but these new vessels are weak and rupture easily, and that will cause them to bleed or hemorrhage. New blood vessels can also leak protein or fluid into the macula and can lead to macular edema. In the early stages, there may be no symptoms or changes to your vision, but an eye check can identify the onset of problems. Diabetic retinopathy has 5 stages. First stage is no retinopathy. At this stage, there are no abnormalities. It's usually recommended to get your eyes checked every 1 to 2 years. No referral to an ophthalmologist is needed. If you're seeing the optometrist, he may say something along the lines of, diabetes can affect the inside of your eyes at any time. It is important that you come back in 12 months so we can examine you again. This will help you prevent losing vision or going blind. The second stage is mild non-proliferative diabetic retinopathy, or mild NPDR. At this stage, microaneurysms occur. They are small areas of balloon-like swelling in the retina's tiny blood vessels. It is recommended to get another check in about 6 to 12 months. Your optometrist may say something along the lines of, your diabetes is affecting your eyes. At the moment, your vision is good, but we must check your eyes in 12 months' time to see if these changes are getting worse. If the damage becomes severe, we will need to treat your eyes to stop the diabetes affecting your sight. At this stage, a referral to an ophthalmologist is usually not required, but avoiding large fluctuations in blood glucose levels and aiming for targets as close to the target range as possible will help to slow any progression. And in many cases, the retinopathy could even improve at this stage. The third stage is moderate non-proliferative diabetic retinopathy, or moderate NPDR. This stage is when blood vessels that nourish the retina are blocked. Microaneurysms and other signs are present. Your specialist may be talking about dot and blot hemorrhages, hard exudates, or cotton wool spots. It is important to get another check in 3 to 6 months. Your optometrist may tell you, your diabetes is damaging your eyes. At the moment, your vision may be good, but we must check your eyes in 6 months, as it is likely that these changes will get worse. If the damage becomes severe, we will need to treat your eyes to stop the diabetes affecting your sight. Unless you're treated properly, risk losing going blind. It is unlikely that you notice any visual changes at this stage, but the damage is there, and keeping blood glucose levels as close to the target range as possible and avoiding large blood glucose excursions will slow the progression to the next stage. Severe non-proliferative diabetic retinopathy is the fourth stage. In this stage, many more blood vessels are blocked, depriving several areas of the retina with their blood supply. These areas of the retina send signals to the body to grow new blood vessels for nourishment. You need to get this reviewed every 3 months. A referral to an ophthalmologist is now definitely required. Your optometrist will say something along the lines of, your diabetes has damaged your eyes quite severely. Although your vision may appear good, you are likely to need treatment soon to ensure that you don't lose your vision or go blind. We must check your eyes in 3 months' time. However, if you think you may not be able to come then, we may treat your eyes now so we can be sure that you don't lose your vision later. And the fifth and final stage of diabetic retinopathy is proliferative retinopathy. At this advanced stage, the signals sent by the retina for nourishment trigger the growth of new blood vessels. And these new blood vessels are abnormal and fragile. They grow along the retina and along the surface of the clear vitreous gel that fills the inside of the eye. By themselves, these blood vessels do not cause symptoms or vision loss. However, they have thin, fragile walls. And if they leak blood, severe vision loss and even blindness can result. A referral to an ophthalmologist should have already occurred by this stage, and you will need monthly checkups. If you see the optometrist at this stage, he would tell you, your diabetes has damaged your eyes very severely. Although your vision may appear good, you are at great risk of losing your sight over the next year. You need urgent treatment to save your sight. Treatment will not improve your eyesight, but it should preserve the vision that you have. Diabetic macular edema, or DME, based on the American spelling of edema, which is without the O, can be found with any stage of diabetic retinopathy and can run an independent course. As mentioned, in the early stages of retinopathy, there may be no symptoms or changing to your vision. However, as retinopathy progresses, symptoms can occur. They can include blurred and distorted vision that is not improved with prescription glasses, something like this. Seeing floating spots or flashes. You may have sensitivity to light and glare, or may have difficulty seeing at night. Diabetic macular edema is an additional and important complication of diabetes, assessed separately from the stages of diabetic retinopathy. As I mentioned in the previous slide, DME can be found in an eye with any stage of diabetic retinopathy and can run an independent course. Eyes with DME are generally classified as either being non-centrally involved or centrally involved. Non-central involved DME should be reviewed every 3 months. Referral to an ophthalmologist is needed, as laser treatment may be required to preserve the vision. Central involved DME involves retinal thickening in the macula that involves the central subfield zone. You should be seen by an ophthalmologist every month, so an urgent referral is definitely required. When the macula is affected, one tends to lose the central vision, like this. Retinal detachment can be a complication of retinopathy. Retinal detachment occurs when the retina separates from the tissue it's normally attached to, like wallpaper peeling off a damp wall. The retina needs to be attached to the back of the eye to survive and work properly. Retinal detachment can result in the loss of some or all of the vision permanently, if not treated urgently. A retinal detachment is usually a medical emergency and needs to be assessed as soon as possible so that your ophthalmologist, your eye doctor, is able to make decisions about any treatment that you may need. It can occur at any age, but this most commonly occurs in Caucasian males over the age of 40. But let me reassure you, retinal detachment is quite rare. It occurs in just 1 in 10,000 people each year. You do have an increased risk of retinal detachment if you are short-sighted, if you had previous cataract surgery, if you had trauma directly to the eye, so an injury or a blow, wearing eye protection when using tools, gardening or for sports, or something you can do to reduce the risk to an eye injury is important. Retinal detachment does not happen as a result of straining your eyes, bending, or heavy lifting. Also, if you already had a detachment in one eye, then there is an increased likelihood of getting a detachment in the other eye. And if you have a family history of retinal detachment. Most retinal detachments happen because of a tear or a hole in the retina that allows fluid to leak between the retinal layers, causing the retina to detach. Holes and tears in the retina can occur because of changes that happen as you age or because the retina has been pulled and torn. Tears mostly occur when the vitreous gel that fills the middle of the eye suddenly becomes detached from the retina, known as acute posterior vitreous detachment, or PVD. That's a mouthful, isn't it? So most acute posterior vitreous detachments, or PVDs, do not result in retinal detachment. A direct blow to the eye may cause a retinal detachment, whereas a knock to the head without any eye injury does not. Other eye conditions, such as diabetic retinopathy, can result in fibrous scar tissue forming inside the vitreous cell and on the surface of the retina. And this scar tissue can then pull on the retina. It's called traction, causing a detachment. A rare type of retinal detachment can occur when fluid from the vessels behind the retina leaks between the retinal layers without a hole or tear being present. This happens because of another condition, such as an inflammation or a tumor. Potential treatments for retinal detachment include laser treatment, which causes very small burns in the area around the retinal tear and hole, which kind of welds the retina more firmly to the back of the eye. Another option is something called cryopexy, and that means that the ophthalmologist freezes the area of the retinal around the tear or hole and similarly kind of sticks it down. The retinal tear or hole is surrounded by laser or cryo, and that prevents fluid passing through the hole to cause a detachment. You can have laser or cryo treatment as an outpatient using a local anesthetic. Your vision is not usually affected by this type of treatment because only a very small localized area of the retina is being treated. Some people require a surgical procedure called a vitrectomy to reposition the retina against the back of the eye. Retinal detachment surgery is complex and individual to each case. The type of surgery depends on the type and location of the detachment and any complicating factors such as eye conditions you may have. Symptoms of retinal detachment include an increase in floaters or light flashes in the eye, potential or partial loss of vision, or the visualization of a curtain being pulled over a section of your visual field. So floaters are caused by bits of debris in the vitreous gel, casting a shadow on the retina. Floaters are actually quite common, and most people can expect to have a few as they get older. People who are short-sighted or have had eye operations in the past often have more floaters. Floaters can take many shapes. They are often described as rings, worms, spider legs, or cobwebs. Here are some examples. They are not generally a cause for concern, especially if they have been present for a long time, months or years. However, if you notice a recent dramatic increase in the number of floaters or notice showers of dust-like floaters, that could be a sign that changes are happening at the back of your eye. Many people experience flashing lights, most commonly around the edges of their vision. Flashes occur when the retina is stimulated by something within the eye rather than by the light entering the eye. They are often caused by the vitreous gel inside the eye moving and pulling on the retina. In most cases, flashes are caused by a gradual vitreous detachment with no long-term problems to vision. However, flashing lights can indicate that there is a tear in the retina. You cannot tell whether the flashes are caused by the vitreous or by a retinal tear. So if you suddenly experience new flashes, you should have your eyes examined by an optometrist as soon as possible. If the retina detaches, it can't work properly, and this will appear as a dark shadow or a curtain moving in from the sides of your vision, which you cannot see around or see through, something like this. If more of your retina detaches, then the shadow will keep on moving towards the center of your vision. If you experience a dark shadow moving up, down, or across your vision, you need to see an ophthalmologist or attend your local eye hospital, eye clinic, or emergency department immediately. Do not delay. A number of factors can cause eye disease other than diabetes. The most common factors are smoking, alcohol, diet, and aging. Many structures in the eye change as we age, and this can result in eye disorders and diseases. So to go through those in a bit more detail. Smoking is thought to affect eye health through oxidative stress. Antioxidants help maintain the lens transparency, so smoking may interfere with the protection from antioxidative nutrients and contribute to macular degeneration. Alcohol may work directly on the proteins in the lens itself and indirectly by affecting absorption of nutrients important to the lens. It is a difficult risk factor to isolate because it's often also associated with smoking. Good nutrition is thought to promote eye health, but it is unclear whether there are any associations between eye diseases and certain dietary factors, such as fatty acids, which are essential for eye development and may protect against growth of abnormal blood vessels. Lutein and zeaxanthin and carotenoids, which are found in the lens and in the pigment of the retina and in green leafy vegetables, and which may also have antioxidant properties and may protect against cataract and macular degeneration. Or nutritional supplements such as riboflavin, thiamine, vitamin A, vitamin C, vitamin E, and zinc. For example, vitamin A is required in the production of rhodopsin, the visual pigment used to see in low light levels. Other risk factors include excessive screen time, and in particularly near work, such as reading, watching TV, or looking at a computer screen, high blood pressure, high cholesterol, and being overweight. Eye tests carried out by an eye health professional will usually include the following common tests. Checking the strength and control of the muscles in the eyes. That's called eye movement or cover tests. Checking your visual acuity. This means making sure that you can read letters or identify symbols and shapes from close by and from far away. This test will help determine whether you need glasses, and if so, the precise prescription of your lenses. Through retinoscopy and refraction testing. Checking the health of the outside of the eye and the reaction of the pupil to light, which is called the external exam and pupillary reactions, and checking the health of the inside of the eye through the use of a slit lamp, including the cornea, iris, lens, and anterior chamber. Depending on your symptoms, eye health, or family history, your eye test may also include checking the back of the eye, the retinal test, or ophthalmoscopy, it's a mouthful, including the retina, retinal blood vessels, vitreous, and optic nerve head. This test will require for your pupils to be dilated with eye drops to allow for a better view at the back of the eye. and it can certainly help identify certain eye conditions, such as retinopathy. They may also want to check the pressures inside the eye through the puff of air test or tonometry that I mentioned earlier. This test can help identify if you may have glaucoma. Checking your field of vision, or sometimes called a visual field test or perimetry, this is to identify any patches or areas of vision loss, is another test that can be done. It is recommended that you have your eyes checked when you're first diagnosed with diabetes, and then on a regular basis, generally at least every 2 years, by an optometrist or an eye specialist ophthalmologist to look for early signs of damage. Have your eyes checked more often if your eye care professional advises, especially if you already had eye problems or you're planning a pregnancy. Your eyes can be checked by an optometrist without the need for medical referral, and it's mostly covered by Medicare. Discuss any changes in your vision between your routine eye checks with your optometrist, your eye specialist, or your doctor. To find a local optometrist, visit the Optometrist Association of Australia website that is listed here. You don't need a referral to see an optometrist, and there's generally little or no waiting time for appointments. Medicare provides a full rebate on most optometry appointments, but does not reimburse you if glasses are needed. Most private health funds will at least partially reimburse you for your prescription glasses, depending on your level of cover. For more information about ophthalmologists, visit the Royal Australian and New Zealand College of Ophthalmologists website that is listed on the page. A referral from a general practitioner, an optometrist, or other medical specialist is required to obtain a Medicare rebate for an ophthalmology consultation. Appointments are prioritized according to medical need, with red eyes commonly seen immediately upon referral. Others may take a little bit longer. For more information on eye health, go to www.visioninitiative.org.au. 90% of blindness and vision loss is preventable or treatable. This rises to 94% for our Aboriginal and Torres Strait Islander peoples. It is estimated that in Australia, over 800,000 people are affected by blindness or vision loss, and that 80% of blindness and vision loss is caused by 5 common eye conditions, which listed alphabetically are age-related macular degeneration, cataracts, diabetic retinopathy, glaucoma, and uncorrected or undercorrected refractive error. In most cases, the earlier eye problems are treated, the better the result. Your eye specialist can advise what treatments are available, but as always, prevention is still better than trying for a cure. There are a number of things you can do to reduce your risk of developing eye problems, and these include aiming for blood glucose levels and blood pressure as close to your target ranges as possible, and aiming to avoid large blood glucose excursions, jumps from very low to very high, and vice versa. Keeping your blood cholesterol levels within the recommended range. Regular appointments with your health professional can help you with this. To see your optometrist or ophthalmologist for eye checks as soon as you notice any changes in your vision, though better still, see them at least once a year. Don't smoke, and if you do smoke, try and quit. If you feel that you can't give up smoking on your own, ask for help. Talk to your doctor or call the Quit line on 13 78 48. You can also speak to a psychologist or a social worker if the health of your eyes is causing you to feel worried or anxious. Keep Sight is a new program designed to make it easier for people with diabetes to get their eyes checked. The Keep Sight program, which is run by Diabetes Australia in partnership with Vision 2020 Australia, the Centre for Eye Research Australia and Oculo, has been co-funded by the Australian Government, Specsavers, Bayer, Novartis and Mylan. The program has widespread support from leading diabetes and eye health groups, including the Royal Australian and New Zealand College of Ophthalmologists, Orthoptics Australia, Optometry Australia, the Australian Diabetes Society, and the Australian Diabetes Educators Association. It provides electronic alerts and reminders to help you remember your diabetes eye checks. When it's time for a diabetes eye check, you get a reminder. It's that simple. Keep Sight can also help you find an optometrist if you don't know one. Vision Australia is a leading national provider of blindness and low vision services in Australia. They work in partnership with Australians who are blind or have low vision to help them achieve the possibilities they choose in life. Vision Australia are a not-for-profit organisation and they support more than 25,000 people of all ages and life stages and circumstances. They do this through 35 Vision Australia centres around the country and a number of outreach programs across the country. Of course, you can also find more information on the NDSS or Diabetes Australia websites or on the website of your local diabetes organisation, such as Diabetes New South Wales and ACT or Diabetes Queensland. I'd like to thank you for watching this webinar. I trust you found it useful and educational. But if you do have any further questions, please don't hesitate to call the NDSS helpline on 1800 637 700 and ask to speak to a credentialed diabetes educator.